I'm Dan Reinstein, Professor Dan Reinstein. I'm founder of the London Vision Clinic in London, and I am the inventor of PRESBYOND. PRESBYOND is the name given to the laser blended vision technique, which we developed about 20 years ago in London Vision Clinic. And we've grown our clinic immensely over the last 20 years just based on this ability to treat aging eyes without replacing the lens inside the eye. Whereas most of my colleagues around me still offer what's called clear lens exchange or permanent lens replacement, which is actually a cataract surgery without there actually being a cataract. What's a cataract? A cataract is when the lens inside the eye becomes dirty. And of course, then you have no choice. You have to take the dirty window out and put a clean window in. But how do you get distance and near vision out of one lens? The answer is you have to put a lens that splits light into 3 different distances. But when you split light, means you don't actually get all of the light at each distance. And so essentially the contrast goes down a little bit. And for some people, it actually can affect their ability to drive at night. So it can be a little bit problematic. Also, a surgery inside the eye is obviously slightly higher risk than a surgery on the surface of the eye, like a LASIK procedure. People ask a lot about how long it lasts. The answer is it is permanent. Just like a lens replacement is permanent, so LASIK PRESBYOND is permanent. However, vision may not be permanent. It usually is. It can change. And why is that? Well, because we're made of biological tissue, not plastic. The good news is that it can be adjusted, and it's very easy to go and adjust it. And we can adjust it as many times as you need during your lifetime. It's not a limited number of times. People sometimes think that permanent lens replacement is permanent vision. Of course, it's the same argument. It's biology. So while the lens inside the eye is permanent, the shape of the cornea and the position of the lens inside the eye can also shift over time. And actually, the most recent study showed that even in 5 years, lens replacement surgery, about 1/3 of the patients will change significantly so as to reduce the quality of the outcome, which is, again, it's okay because you can adjust it, but you would adjust it with laser. So if you're going to do lens surgery at a higher risk with more side effects and then need to adjust it with laser, I would say, why don't you just do it with laser in the first place and save yourself the extra risk for the younger eye? Right. The interesting thing about lens surgery is that, quite opposite to what would be intuitively thought, the older the eye, the safer the lens surgery. So actually, it's better to do cataract surgery when you actually have a cataract rather than when you have a clear lens, as long as you're a candidate for having PRESBYOND. Now, not everybody's a candidate for PRESBYOND. How do you decide? Well, you don't. What you do is you go to a surgeon who can offer you both procedures and knows the differences and knows all the testing protocols and has the machinery to determine whether your eye is more suitable for one or the other procedure.